Hello, I'm Tina Jennings. The doctor I'm about to sit down with today once served as a physician and surgeon in the Air Force during the Desert Storm conflict, and now his talents are at Saguaro Surgical and Southern Arizona Laser and Vein Institute. Dr. Michael Probstfield is here to explain how he is able to help people. Doctor, thank you so much for coming in today.
Thank you for having me here, Tina.
And we're actually going to start out with something called venous disease and what that is.
Venous disease is a very, very common condition. Probably 20–30% of the American population suffer from it to some extent. Sometimes it's a more minor condition, just cosmetic, and sometimes it's more severe and potentially harmful to one's health.
Wow, that stat was actually quite shocking. I didn't realize that percentage. Now, I know a lot of us may be familiar with spider veins or varicose veins, and those are something that is terms I think that we're more familiar with. Tell me a little bit about those.
Well, spider veins are sort of varicose veins. They tend to be more of a cosmetic concern, and that tends to be what brings the majority of people in. Varicose veins tend to refer to the larger bulging veins that you sometimes see people have and are associated with more complex conditions, sometimes blood clots, pain, swelling, aching, and fatigue, and can result in more serious conditions such as stasis ulcers on the ankle or legs. It can really impact one's life. And
so what causes them?
Probably multiple factors, Tina. Heredity is a big cause. Other lifestyle things such as standing for long periods of time, pregnancies, obesity, things of that nature can result in some of the conditions that result in varicose veins.
I know we were saying that spider veins, like you said, are kind of more aesthetic, I guess, or something that we see. Can spider veins lead into varicose veins, or are they just completely separate?
They're often seen together.
Okay.
Spider veins don't become varicose veins, but they're often seen together. Some people just have the spider veins, which is predominantly a cosmetic consideration, and they can be treated as such. The larger varicose veins are also of a cosmetic concern, but can lead into health issues beyond just the cosmetic.
Well, let's kind of dive a little bit deeper into, like you were saying, the medical. Like, I'm sure what you're saying is a lot of people see them on their legs and they don't like the way they look, and that may be what brings them in is they want to get rid of them aesthetically. But tell me a little bit more about beyond that and the medical conditions.
What we do is evaluate patients when they arrive, both physical examination, but then the crux is a diagnostic test, an ultrasound, to see how the veins are actually functioning, to see if the predominant veins are working well that can result in some of the obvious visible venous disease. Ultrasound is a simple procedure or test that's done in the office to identify that, and then we kind of go to the crux of the problem. If it's a deeper venous problem, we address that first before attacking the more visible venous disease. And
now, of course, we've learned a little bit about each. We just saw the symptoms that were up on the screen right now. Let's talk about treatments for each.
Well, we'll start from the simple to the more complex.
Yeah.
For this patient who comes in with just pure cosmetic concerns for spider veins, it's a very simple treatment. Sclerotherapy is what we call it. We use a very, very tiny needle to inject these veins. It's virtually painless. It can be done in about 15 minutes and has a very high safety profile and very good success rate. In patients who have more complex venous disease, as demonstrated either on their exam or their ultrasound test, we can get rid of the deeper veins with various procedures, either using a thermal energy technique, laser or radio frequency ablation, or a newer technique that we've started to employ, referred to as Vena Seal. For bulging veins, I do an office procedure to remove them with tiny, almost microscopic punctures to remove the veins. Cosmetically, outstanding results, and then we make people feel better. The legs are better and prevent future problems and complications.
Kind of tell me a little bit more about this Vena Seal procedure and exactly, you know, what it's for, what you would say is the right candidate for that.
Well, the crux of most complex venous disease has to do with the condition we refer to as venous reflux. And that means the veins are not working properly. The veins typically have one-way valves, and because of the conditions we referred to earlier, aging and heredity and pregnancy, those valves become weak and then the blood pools in the leg. So that vein is not functioning properly, and we need to eliminate that vein. Historically, that was done with an operation called stripping, which is not really done anymore. To eliminate that vein, we can either heat it on the inside with a laser or a radio catheter. The Vena Seal is a more novel approach. We introduce a very tiny catheter and virtually glue the vein closed, putting tiny, tiny little spots of glue along the course of the vein, compressing it, and basically obliterating that channel. Patients often ask, well, what happens if that vein isn't there anymore? The reason for doing the more comprehensive ultrasound study is to demonstrate functional deep veins deeper in the legs that are working well. So it's a great technique. There's virtually no pain and immediate return to recovery after this procedure compared to other types of procedures.
Wow, this is very interesting, and this video is as you're explaining it to us, this kind of gives us a great visual of what's happening. So really the thing we want everyone to take away from this is to come in, see if you are the right candidate for this procedure, where you're at, and what we can do. Exactly.
Whether it's a cosmetic concern or a more medically related concern, we offer the full spectrum of treatment, and I'd be delighted to see anyone who comes in.
Well, absolutely. I'm going to tell them how they can get a hold of you. But again, Doctor, thank you so much. This was very interesting.
Thank you for having me, Tina.
Absolutely. For more information, you can call 520-318-3004 or visit www.saguarosurgical.com or www.salvi-tucson.com.